Hi everyone, you're welcome back to my channel. My name is Becky Setra. I hope you're doing well. So back with another educational video, and in today's video we're going to be talking about another case where a nurse has been struck off as a result of breach of patient confidentiality for personal gain. If this is the first time you've come across my channel, you're very welcome. Please remember to like, subscribe and share. And you need to watch the video to the end so you would share your thoughts and some of the lessons you have learned as well. So let's go straight into the video. So you're welcome back to the main video. So basically this nurse, once again, this is purely educational. We all learn from people's mistakes, and feel free to share your thoughts at the end of the video as well. Once again, so this case is based on a misconduct of an adult registered nurse, and this person was reported to have been registered as a nurse since around 2002, so very experienced nurse. So let's go into the charges. The first charge is the fact that the nurse has assessed patients' record, so a few patients' record. So these are patients that were known to the nurse through clinical treatment. And the reason for, there is no justification for the nurse to obtain their phone numbers. The second charge is in the fact that the phone numbers were obtained in order for the nurse to promote a non-prescribed or unlicensed product. Another one is also she has contacted one or more patients. And another charge is the fact that she did not advise the patients about the fact that, or the importance of them continuing to take their prescribed medication. That is, for example, if they decide to buy whatever product she was offering them, she hasn't told them that it is important for you to continue taking your prescribed medication. Another charge is the fact that during a clinical consultation, the nurse actually attempted to sell a non-prescribed product to a patient. So during your work for your employers, you're trying to promote your own product. Anyway, another charge is the fact that the nurse actually, or alleged to have, the nurse was alleged, I wasn't there, to have asked the patient for their Facebook profile name and actually added this patient as a friend on Facebook whilst in clinic. You cannot do that. You have to be careful how you become friends, or the relationship you have with your patients. You have to be extremely careful. The fourth charge is the fact that in relation to the charges above that we've talked about, the nurse's actions demonstrated lack of integrity, and the nurse was deemed to be taking advantage of her role as a nurse and putting her own interest before that of patients. And in light of all these charges, the fitness of this nurse to practice is impaired by reason of her misconduct. Anyway, so let's go on. So basically what happened was that this nurse was working in an outpatient department. So the person or the nurse assists doctors and she coordinates care in the outpatient department. By doing all this, she got to know some of the patients who have been coming to clinic. This nurse had a business, and there's nothing wrong with having your own private business as part-time whilst you're working for a company or a hospital. But what is not right is for you to be promoting whatever your business is to patients whilst you are in clinic. So an internal investigation took place and 17 patients were actually contacted, and the nurse was found or noted to have obtained their contact details and tried to sell products to them. There was no evidence actually that any of the patients bought the products that the nurse was selling. So during the process, the nurse made full admission. So the nurse actually admitted the charges. Unfortunately, she did not show any insight into her actions. She did not really show the knowledge that what I have done is a breach of patients' privacy and confidentiality. And these are things that are very commonly asked when we go to interviews. I don't know if they still ask them. They used to ask that confidentiality question a lot those days. And actually, after all that as well, the nurse did not take any remedial actions. So they gave her the option or opportunity to show that, you know, she has learned out of it. She's reflected. She has done some courses to show now her knowledge has improved in dealing with such situations. But she didn't. She did not take any action or show any insight into her actions. Her actions fell short of the standards expected of a registered nurse. Now, what are some of the aggravating features or factors in this case? One of them is the fact that there was an abuse of position by exploiting vulnerable patients for financial gain. Once again, this person had a website and sells products that are reported to be more or less like supplements, but you don't promote that in clinic. Another factor is the fact that she was potentially putting patients at risk, because if you're not telling them that even if you buy this supplement, you need to continue taking your prescribed medications, then you're putting them at risk. Some of them could stop taking their prescribed medication, thinking that whatever you are selling them is what they need to concentrate on. There has also been reports of persistent contact over an extended period of time. Also, another factor is the fact that this nurse sent volumes of sales materials to some of the patients. She actually showed very little evidence of remedial action, which I've talked about. The nurse actually breached the privacy and GDPR policy for personal gain as well. As you know, hospitals or employers are very much on the high with the way we use personal data for patients, or actually our own personal data as well. So what are some of the codes that the nurse breached? One of them is treat people with compassion, and you need to respect people's right to privacy and confidentiality. And clearly this did not take place in this case. So what happened? An interim suspension of 18 months was imposed, and this would be replaced by striking off, and this allowed a period of 28 days where the nurse would have to appeal. So what are some of the lessons I have learned and I can share with you? Clearly, this person has breached that, because after dealing with the patients, she goes, when the patients are gone, she goes into their records and then she finds their telephone numbers and takes them with her in order to go and contact them while she's at home for her to promote her personal products that she was selling. And also, before you access anybody's personal data or details, you need to do that with their consent. This person actually accessed patients' details without their consent. Another thing I have learned is the fact that we only have to access patients' personal details where there is a legitimate reason. So the nurse was also, in a way, she was misusing her position of power in this case, because you've got access to patients' details. It doesn't give you the right as a nurse to take those details, go away and do what you want to do with them for your personal business. So basically, those are the things I have learned. I don't know what you have learned out of this. Once again, be very careful what you do with patient details. confidentiality is very important in our day-to-day life. You don't go sharing patients' details, or somebody would say, oh, I want to check my own. So I was doing my e-learning recently, and I've always done it every year anyway. Your own blood results, when you're at work and you've got access to the database where the blood results are, you can't check your own blood results. You need to call your doctor to ask for what your blood results is, if you have done something, if you've gone for any blood tests. So friendships, you don't go, you know, becoming friends with your patients. You need to keep your relationships with your patients and their families professional. Otherwise, it would come back to bite you one day. So be very careful what you do as a nurse. These videos, I do them. Some of the things I learn as I do the videos as well. And basically, those of you who are new to the UK, these are some of the things you need to know. Sometimes we take certain things, you know, lightly from our home countries, but when you get here, some of these things are not as we probably were used to from our home countries. I hope it's been helpful. Feel free to share your thoughts, what you have learned from this video. Anyway, take care of yourselves, and I'll see you again later. Bye bye.